as a parent, if you have that knowledge and someone informs you that there are treatment options available, or even talks to you about a concern that they've identified in your kid, I really tell parents and caregivers to listen to what it is that teacher, that pediatrician, that church leader, the coach has to say about your kid, because that's information for you to better understand your kid.
I made it through the rough time. I made it through the tough time. I made it through the bad time. So now I gotta get mine. Gotta weather the storm. Gotta get mine. Gotta weather the storm. I gotta get mine. Gotta weather the storm. Okay. One day we gon' get on. Talk to 'em. You ain't got a choice.
Welcome to Bailey and Buck Unplugged, where we talk about sports, entertainment, and mental health in support of the Kennedy Kids Foundation. If you're struggling with mental health, we encourage you to speak up and get help. A great place to start is 988. That's the free crisis prevention lifeline. Or you can check out the resources tab at kennedykids.org. If you are in an absolute emergency, please dial 911. Either way, we want you to know that you are not alone and that you don't have to struggle, and speak up, get help. There are resources available to you, and we are here to support you. If you're new around here, I want to introduce you to our host. I am Misty Buck. I am an author and a mental health and performance coach. And my co-hosts are Robert Bailey. He is the president of Rosenhaus Sports, the president of Kennedy Kids Foundation. He's a two-time Super Bowl champion, two-time college national champion. He's an NFL record holder, and he's an ESPY winner. And we are also joined by Bailey Brooks Mashburn. She is a celebrity wedding and event planner, a former NFL cheerleader, and the executive director of the Kennedy Kids Foundation.
Hey, and welcome to a very special episode of Bailey and Buck Unplugged. You know, usually we're speaking with athletes and celebrities, but we have a different type of celebrity today. Our guest, Dr. Christine Crawford, is a nationally recognized leader in psychiatry and mental health advocacy. She currently serves as the Associate Medical Director for the National Alliance on Mental Illness, or you might know it as NAMI, bringing together her clinical experience and deep commitment to breaking the stigma around mental illness, which you know we are all about here. She happens to be a board-certified adult and child psychiatrist, which we'll jump into what exactly that means today. And she's done amazing, amazing work, including she's the author of a book called You Are Not Alone for parents and caregivers, which I think is really cool. I cannot wait to grab a copy of this because Jay Shetty called this, we know Jay Shetty, right? He called this the essential guide, or just essential for those struggling with their children's mental health and looking for a path forward. So to me, that speaks volumes. And so I can't wait to hear about this. I can't wait to have this conversation, because you guys know that this show is brought to you by Kennedy Kids Foundation, where we advocate for youth mental health and supporting caregivers. And so we think this conversation is going to just be one of our best. And so we are so excited to welcome you, Dr. Crawford. Thank you so much for making the time in your very busy schedule.
Thank you.
Yeah, thank you for
Great to have
having me.
you.
Yes,
Great to
thank
have
you.
you. Well, you know, I first met you and got to know a little bit about you from one of the NAMI events that you guys did here in South Florida. And I thought you were extremely interesting, especially as a Black female. And I said, man, I got to get her on our podcast. You know, Kennedy Kids, we focus on mental health awareness for teens, suicide prevention. And I said she would be perfect for the podcast. Before we really get started on what you have become, your impact in this area, the first thing I want to ask you is, as a child or in your teenage years, did you ever go through any mental health issues, and how did you end up coming out of that at that age?
Yeah, so again, thank you so much for having me. Really appreciate any opportunity to talk about mental health, especially when
Yeah.
it comes to young people. It's such a needed conversation. Even way after the pandemic, I'm just really encouraged by the fact that we're still talking about mental health in a meaningful way. But this is such an important question to ask adults. because for a lot of kids, they feel alone in some of these experiences where they're having difficulty with really big emotions, where it's a challenge for them to regulate their behaviors, where they feel like they don't belong and they feel like they are the only ones on planet Earth who are going through these things. But the more that we share about our own lived experience with our young people, they'll realize, oh, well, having big emotions and having difficulty navigating those big emotions, struggling to identify which tools and strategies can be helpful to navigate, oh, that's not something people just know how to do right off the bat. So I actually love this question. It's the first time I've ever been asked this question. But as I'm reflecting on my younger years, really struggling with a lot of anxiety, but did not know that that's what it was, right?
Oh,
Um, and there weren't conversations with my pediatrician about my mental health. There weren't conversations with my parents about my mental health. And they didn't come up in school either. So I just thought it was something about me in which I just had difficulty blocking out worry thoughts, blocking out thoughts that were difficult for me to control, that made it
what
hard for
age was
me.
this?
Yeah,
What age was this?
I would say in high school, and
Okay.
that has continued high school, college, and even present day,
Oh,
you
wow.
know. But yeah, anxiety is a very common condition, but at the time I just didn't have the language to describe what it was I was feeling, nor the tools for how to cope. But what I did learn very early on that was by distracting myself with doing a lot of things, whether it was after school activities, tennis, being president of student council, just doing the most. But then I was like anxious about doing the most, but it kind of distracted me from all of these things I was worrying about. But yeah, so many kids struggle with anxiety, and I'm happy that you asked me this question, actually. I love it.
Well, you know, so usually, and it manifests itself, right? And it came out as an anxiety. At what at what point do you remember really stepping out and addressing it, right? Especially as a psychiatrist, right? At what point did you say, hey, now I know what this is, or hey, I want to talk about this. I really need help. Or did you address it yourself? Did you, self-medicate? Did you speak to someone? I know you didn't just go through this period of your life of having this symptoms happen to you and
Mhm.
then it just goes away. There's something that you did, and I want the listening viewers to hear kind of like what you decided to do. And I'm
Mhm.
assuming, as you say, you still have it, but at some point you addressed it. And now you may be more in control because you went through school and you became a doctor. And so see if you can expand on that.
Yeah, I think this is important because there are a lot of people who are walking around with anxiety and they look like they're functioning okay
Yeah,
without having any treatment whatsoever,
that's
right?
me. That's me.
You see what I mean, right? And so this idea about, what did I do along the way? I mean, what I did was I just kind of overcompensated by constantly seeking out various ways in which I could get reassurance that the
Right.
things that I was worried about, I didn't have to be worried about.
I
And
got you.
so I've noticed that I've kind of set up my life in a certain way that allows me to manage my anxiety. And that's the privilege of being an adult. Versus
Right.
when I was younger, I just had to deal with the cards that I was dealt with the environment that I was in. But I've noticed that over the years, some of the relationships that I have, some of the ways in which I engage with people, and some of the things that I do. I mean, it's really kind of structured in a way to mitigate anxiety. But talking about professional help, let me tell you, I've been in therapy for 8 years, but it wasn't until December, so we're talking 8 months ago, that I was
Mhm.
having meaningful conversations as to what this is looking like and how is interfering with my ability to function.
That's
Right.
so interesting because there's so many layers to it, right? Like, so I've also been in therapy for many, 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 many years. And I'm constantly discovering new things about myself. So I'm interested to hear more about that from you because it feels like you're just peeling back layers and peeling back the onion, and you're kind of like willing to go there consciously with surface level stuff, and then behind that, and then as you get to know a little bit more and a little bit deeper and a little bit deeper, and then you're like, okay, there's that little girl for me. You know what I mean? So
Hmm.
can you talk to us more about that? That's really interesting that it's taken you 8 years to start to really get to the meat of some of these things.
Yeah, that's right. Because over the course of the 8-year relationship that I've had with my therapist, she also has developed a deeper understanding of me, right?
Mm-hmm.
Through going through all of these different life transitions that I've had. This is a woman that I started working with when I was a trainee, when I was a resident. So she worked with me as I was trying to navigate residency. I was in my third year residency. This was before I had kids. This was before, all of this stuff with my marriage and what have you. It was a different phase of my life. And she's been with me since I transitioned into becoming an attending. So, like a regular, real working doctor, to, being pregnant, becoming pregnant, and that not being planned, having kids and just navigating all these different stages. So, she's been able to identify these patterns in my
Mm-hmm.
behavior, these patterns in the way in which I think, and she'll bring it up time and time again. But it takes a long time for you to like allow it to sink in and to click, because there was a lot of denial on my end, a lot of defensiveness towards it. But I think initially when I started, to be quite honest and direct with you guys, I only started it because I was learning how to be a therapist. And so I was like, well, how am I going to be a good therapist and do
So interesting.
psychotherapy if I haven't been on the other side? So that was the only reason why I got into therapy, was because I wanted to better understand it so I could be better for my own patients, right? Um,
Wow.
That's so
I
At
know.
interesting
what
that
point, yeah, at
that's
what
so
point did you say,
interesting.
like, let me let that wall down instead of being here as a student, let me be here as a patient?
And that took so long because, like I said, at the beginning, it was more like, all right, let me just kind of go through the motions.
Right.
I was going through the motions. But me going through the motions was a reflection of how I was just in survival mode. And I was living in this constant fight or flight mode, right? That I didn't even have the capacity to take a step back and really kind of assess what was happening, why I was moving in a certain way, why I was navigating life in a certain way. I just had these blinders on, right? Because I was just trying to survive. But then life just slaps you across the face and you can no longer deny what is happening. And for me, the slap across the face was not being able to get out of bed, not sleeping properly, not doing well with some of the administrative aspects of my work. Emails were piling up, phone calls weren't being returned. And that was the manifestation of my anxiety. It was really avoiding living life, doing the things that I needed to do. And once that, impacted work, once it impacted my relationships, my ability to be a good mom, that's when I had to open up with my therapist and be like, look, this is what I'm actually going through. Can you help me? And so, yeah, I've been on medication since yeah, for the last 8, 9 months, and it's been very helpful in addition to being in weekly therapy.
I got a question. You've been a
Hmm.
doctor for how long?
Ooh, so 11 years now?
You've
Hmm.
been a doctor. This is mind blowing. You've been a doctor for now 11 years. You've had this anxiety since you were a little kid. But even going through the journey of your anxiety, becoming a doctor, which takes studying, reading books in class, learning about the mental health,
Hmm.
the medicine, the what do you call it? The medical health about mental health, right?
Mm-hmm.
So going through that whole process, and still you've been only on medication for less than a year. With all of the stigma around mental health, it's incredible that even with you, it took a long time for you to get to this point, right? And
Mm-hmm.
how do you feel? And you're interesting because you've actually lived it, and you're still living it. And so how
Mm-hmm.
do you feel about the whole stigma around mental health? Because for us, we see that it's very hard for us to get parents to really get active with their kids and their mental health,
Mm-hmm. Mm-hmm.
right? So how do you feel about the stigma, and how can we break it down, especially after you've gone through what you've gone through, and kind of also pushed it away as long as you possibly could until 8 months ago when you decided to medicate?
Yeah. The way that I think about it and the way that I talk to parents about the stigma related to getting their kid into treatment, I talk about just their child and imagining that each and every day their child is in pain and their child is in distress and their child is suffering. There's absolutely no parent or caregiver on this planet Earth that would want their kid to experience that each and every day. And for
Right,
a lot of kids who are living with depression, who are living with anxiety, PTSD, or any mental health condition, that's what it's like for them to exist in this world. So why should we deny them an opportunity to experience what life is like a little bit easier, like with the tools that they need to navigate things with ease, with greater ease? And for me, I didn't know that there was an option to navigate through life in an easier way, right? And so, as a parent, if you have that knowledge and someone informs you that there are treatment options available, or even talks to you about a concern that they've identified in your kid, I really tell parents and caregivers to listen to what it is that teacher, that pediatrician, that church leader, the coach has to say about your kid, because that's information for you to better understand your kid. And so the idea of denying yourself an opportunity for really knowing what your kid is like outside of your home and how it is they're navigating relationships in school, academic issues, how they're dealing on the sports field, right? That's all information. And you want to make things easier for them. And so whether that's exploring options around therapy, which I always talk about therapy first and foremost, because when I think about therapy, it's really equipping these kids and adults with tools, with strategies, right? Because these kids are walking around with a toolbox, and they're born with this toolbox. The toolbox is empty. And a lot of us think that through osmosis, kids just learn how to manage their mental health. But we got to be intentional about putting the tools in their toolbox. So if we notice that there's certain tools that by a certain time and stage in their development that we're noticing is missing because of what it is we're seeing in their emotional state, because of what it is that we're seeing in their behavior, we ought to figure out, how can I make it such that I get my kid access to these tools? And for some, medications is that, and for some, it's therapy. But you can't access therapy in terms of getting these tools if you can't get out of bed. You can't access the tools that are offered to you in therapy if you're so tired that you are nodding off. You can't access the tools of therapy if you think that life is no longer worth living.
right. That's such
Um,
that's so amazing. That's a powerful statement that you said, and it's very interesting that that's the approach you have with the parents. Um, when when it comes to giving medication, there's a big stigma about that, and parents, even in with my son, his mom, my son is seeing a therapist, and they prescribe medicine, and we have yet to go get it because she's like, I don't want him taking medicine. And every time she says that, I think about you because I remember the speech you gave about, you know, the outlook on medicine from parents, you know, and you understand. So what, you know, what do you think, especially someone who's taking medication to help their anxiety? What do you think about the stigma that parents have about medication? And why do they, you know, I know everybody hates big pharma and they say, oh, they're just prescribing pills to my kids and they don't need it. And
Mhm.
what do you think about that whole notion that medication for kids, it's like the stigma and that parents think it's bad?
Yeah, yeah. So I know that as a parent, it's hard to hear that your kid is struggling because automatically you go to this place in which you're thinking, did I do something wrong? Was there something that I didn't have in place for my kid to make it such that we could avoid being in this situation? So there's a lot of this internal dialogue with a lot of parents thinking, okay, what if this? What if that? What if this? Did I do something? Is this my fault? Is my kid mad at me? And this is their way of showing me that they're mad at me. There's all of these what ifs. And it's only because when it comes to mental health conditions, they're conditions that are the manifestation of the mind, the emotional aspects of the mind. We see these through the relationships that we have, right? Rather than testing someone's blood, being like, oh, you have this problem, right? And so it's interesting with psychiatric conditions where there's just, I don't want to say a lot of denial, but it's just hard for people to wrap their mind around the idea that these are medical conditions that are biologically based. So you can do all the what ifs that you want, and you can do that for 1 year, 2 years, while your kid is still growing up and they're missing out on critical time in their lives to be able to form nice relationships, to get the learning that they need in school, because you're just sitting there trying to figure out what did I do wrong and what do I need to put in place, right? And that's the biggest struggle, right? But when it comes to other medical conditions, right? If someone were to tell you that your kid is suffering from asthma, that each and every day it's hard for them to breathe, of course you would give them the inhaler. And for some, inhalers have some side effects, right?
Right,
But the idea of like you're living with depression, you're living with feelings of not wanting to be alive, it's almost feeling for that kid as though they can't breathe, right? And so we really need to think about it from that standpoint and also appreciate the fact that these psychiatric conditions are life-threatening conditions. Life-threatening conditions. This is
right,
not a personality issue. It's not a character flaw. This isn't bad parenting. This is a
right,
life-threatening medical condition that warrants an intervention. So when I explain it like this, and I'm not trying to use scare tactics, I'm just trying to use facts,
right,
right? As someone who has met with kids in the emergency room, have had these parents with these conversations with parents who have found their kid in a state of crisis, right? These are conversations that I'm having, and I want parents to not have to find themselves in an emergency room or in a crisis. But the only way we can get there is really thinking critically about, okay, what is my kid going through? What is the information that I'm getting about my kid? And what are the options that are available to give them what it is that they need in order to no longer live with this distress and feel like they can't breathe in the same way asthmatic feels like they can't breathe.
Yeah,
oh,
and I want to thank you for sharing this because again, you're coming at this, you're a medical doctor, right? And I don't necessarily know that that's common knowledge. That's a psychiatrist is you went to med school, you are a medical MD, it's
Mhm.
you did your residency as you were talking about. So you're really well versed in the medicine. And I want to preface my question by saying that I too have been on medicine for my mental wellness in high school. I took Paxil for bout with depression. About 10 years ago, I did Lexapro for very bad anxiety that I was facing. And to me, they were temporary that I was on these medications. And to me, in my personal experience, I want to be very careful about saying that, it was temporary because I needed a reset. I needed to be able to think clearly so that I could accept the tools, that I could learn the tools, that I could have the energy, that I could have the clarity and the balance to be able to take those steps forward into other remedies like mindfulness, like meditation, other things that work for me personally, that help manage anxiety and help manage depression and some of these other mental health things. So my question for you is, as a doctor, can you sort of explain, maybe because medication still sounds scary, right? So can you kind of explain a little bit more about maybe how it works and sort of what your experience has been, to maybe destigmatize that part of mental health treatment?
Yeah. So this is very common because a lot of parents and a lot of people think, oh, they'll just grow out of it. You know, they have anxiety, they have depression, they'll just grow out
Yeah.
of it. What it is that we're seeing is we're seeing the manifestation of neurodevelopment. Okay. So the brain doesn't fully develop until a kid is 25, right? And so for some kids, as they're going through their neurodevelopment, they're forming essential and critical connections in various parts of the brain into, the language center, the emotional center, the front part of the brain that helps with your ability to organize and plan, executive functioning, right? But there are some kids who need some additional support because those areas are maybe lagging behind on making certain connections. They're still developing. So a great example is ADHD, right? And ADHD is really an issue around executive functioning. So planning, organizing yourself, not forgetting things, being able to focus, right? But if you are a 10-year-old and those connections in the front part of your brain aren't that great, being on a stimulant just helps to provide a little bit of scaffolding or
Right.
support as the kid is growing and forming those connections. So who knows? Maybe 5 years later, 6 years later, that part of the brain looks different than it did when the kid was, 13 or 12, right? And when people kind of think about it from like a neurodevelopmental standpoint, thinking about brain biology, they're like, I can kind of see why kids might need some more support and why that can look different over the course of time. The other thing is, a lot of people think that if you receive one psychiatric diagnosis, that's it, right? Oh, I was diagnosed with generalized anxiety disorder. Oh, that's what it is forever. But people change, symptoms change, and things evolve, right? So these diagnoses, they're not permanent when it comes to kids, right? And so as a psychiatrist, I just think about whether or not someone has met diagnostic criteria for these conditions. You could have met diagnostic criteria for anxiety when you were 14, but at age 30, you don't, right? And so we think about it as, these conditions that have the potential to evolve over time because you are changing over time. You're learning new tools. Your brain is different. You've had different experiences to reassure you that you can get through these difficult moments. But when you are going through these different scenarios as a child, you're literally going through this for the first time ever. So
Right.
you don't know if you'll be able to tolerate being picked on in the cafeteria and everyone calling you out of your name and thinking that is the worst thing in the world and you can't survive that, right? But if you go through that experience knowing that, okay, I can actually live another day, there are ways in which I can navigate it, then you have the confidence to know this is a difficult time, I can get on the other side of it. But for a lot of kids, they don't know that because they haven't been through this before. So they don't have all the experiences. They don't have all the brain connections that are forming. They don't have all the tools. So I just think about medications as just providing that scaffolding to allow kids to function. That's what it's all about. It's not about performance enhancement, which is what a lot of people think about when it comes to the stimulants and ADHD. They think, oh, I just give it to my kids so that they do well in school. So I do it Monday through Friday during the academic year. No, 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 no. these medications allow a kid with ADHD to not only be able to pay better attention in the classroom, but they're able to pay better attention to their family members, to their friends, so that they can learn the social skills that are necessary. They're
Right.
able to pay better attention to themselves and their emotional state, their physical state, so that they know how to take care of their body. It's about all of that when I'm thinking about kids and thinking about medications.
How do you know when for parents who worry about these pills and medication that kids are going to be on for how do you know how long they should stay on the med? Is there a brain scan that, like you say, there's the development? Is there a brain scan that you can see changes, or is it just through therapy and talking over the years when you decide, okay, he or she can come off this particular medicine? And also for Misty, you were on and you said you came off.
Mhm.
How did you know it was time to come off? That's kind of my question.
Yeah, and this is why it's so important to work with a mental health provider or even a primary care provider, because let me tell you, mental health conditions are primary care conditions. So a lot of people don't realize that pediatricians, they're the ones prescribing most of the stimulants and the antidepressants because these are primary care issues. And what it all comes down to, and I keep using this word, is function. How is the kid functioning, right? And so if they were struggling with their relationships with other people, if they were struggling academically, if they were struggling physically to get out of bed, to eat, and we're seeing significant gains and improvement that are sustained after a certain period of time, at least 1 year, if it's major depressive disorder or even some of the psychotic disorders that people might have, if we see stability for at least a year, then we can explore conversations around taking the child off of it.
I
But
got you.
these are also chronic conditions for a lot of people. And so there seems to be this sense of urgency for a lot of parents to get their kids off of the medication. And it's mainly because of a lot of things. They're worried about long term issues and it damaging the brain or what have you, or affecting the kid's personality. But, we've done a lot of research on these medications, and most of our meds are not new. They've been around for decades. There
Right.
hasn't been a lot of cool and exciting drug development, maybe a few here or there, but it's not like we have an Ozempic in psychiatry or something like that,
Right.
right? So
Right.
they've been around for a while. People have been on them for decades. So they've been pretty well tested, and we know kind of the long-term effects of it. But I think this sense of urgency to get your kid off of it, it's like reassurance to the parent that like things are better, that their
Right.
kid is
Yeah,
fixed.
I
And
think too, like there's another important part to that since we're having this discussion, and I'm sorry we're spending so much time on this, but we haven't talked about this on the show before, and I think this is so
It's
important.
important. Yeah, it's
It's really
important.
important. I think it's important for people to, and again, this is only from my experience, not a medical physician as you are, but that to remind yourself that it takes time to adopt to the medicine once you start taking it. But then you can't just quit it cold turkey because there are risks that are there as well. So can you just sort of briefly touch on that as well, just so that we're painting a little bit more of a full picture here?
Yeah, so if you've been on medication to help with anxiety, to help navigate a major depressive episode or ADHD or what have you, right? Um, it can be incredibly helpful. And it can also be the sort of thing that once you come off of it, those symptoms that were managed while on medications can get worse. A lot of people think that when they're on meds and they feel better, that means they no longer need the meds. They feel better because they're on the medication, as
Right.
well as doing other things. But it's like,
That was my
why?
question that was why I asked the question, like, how do you know when to take a patient off?
Yeah, and if they feel better, then oftentimes they want to come off of it. And I tell
Right.
them that if they were to, then that's going to increase the likelihood that they're going to go back to how they felt before. And
Right.
for some people, they don't want to experience that again. And so that's why a lot of people, remain on medications because maybe that depressive episode was so severe. They were in a psychiatric hospital and they never want to have the slightest possibility that that could happen again, right? So, continuing or stopping, I think about the symptoms for which they were treated and how that can actually change once they're off the meds. Now, to your point about side effects and coming off of medications, this is also a very big concern because then people think, oh, well, I'm addicted to these medications. My body is dependent on these medications. That's like saying your blood pressure medication, you're addicted to that. Like, really think about it, right?
Right.
Right.
Of course, if you come off of the blood pressure medication, your blood pressure is going to go up. You're not addicted to it. You haven't developed a dependency. It's that your body just needed that additional support in order to lower its blood pressure. It's the same thing with psychiatric medications. It's the same exact thing. Now,
Okay.
there are
I
some
didn't know that. I
medications.
didn't know that.
Yeah.
I did know that.
I mean, the only medications that have the potential for addiction are the medications in which people are addicted to. So, opiates,
Yeah.
Right.
pain
Right.
medications, right? So,
Right.
Valium, all this stuff, benzodiazepines, those are medications that people can form a dependency on because of the part of the brain that these medications target. But antidepressants, they don't target the same areas. Antidepressants, they don't target the same areas. So your body isn't becoming addictive. It's just that when you come off, it's just that your body has to get used to it not having this certain neurotransmitter, whether it be serotonin or dopamine, floating around at the same level. So your body just needs to gradually get used to having less of that neurotransmitter floating around. So that's why we taper people off of
Right.
medications. We could do it over the course of weeks. We could do it over the course of months. And again, it's just getting your body acclimated to kind of being accustomed to less of this neurotransmitter. But also, we can see how your mental health symptoms
Right.
are over the course of
Right.
time. So we're doing it
Right.
slowly. But if you stop at cold turkey, you can experience things like flu-like symptoms. So having muscle aches and pains, just feeling really crummy,
Right.
experiencing these brain zaps, all these different things. But again, it's just because your body has to get used to it, not having that neurotransmitter involved. It doesn't mean you're addicted.
Wow. Well, I know that we have so many more because I feel like we need to do a
I
part
I
two of
think
this
we need a
episode.
part two.
We need a
I think
part
we
two
need to do
because I
part
didn't
two
even
of
get
her.
to the questions I actually intended to ask at the beginning because we got on this whole topic, which I think is extremely, extremely important because I do think that there's a lot of stigma and misunderstanding around this particular piece of mental wellness and mental health. So I hope we can do that. But I want to be respectful of your time and of everybody else's time. But let's definitely try to set up part two. But we always like to close out by asking our guests a question. So, and by the way, I think one of the themes of this show is psychiatrists, they're just like us, kind of like celebrities, they're just like us. Because the things that you're saying, I'm like, did you read my diary? Because some of this sounds just like me, like just kind of going about my life, having anxiety, just dealing with it, having no idea that that's what it was, right? So, so I totally identify with you in that, and I thank you for your transparency. But so one of the questions that we like to ask is, what are your top tools, like your top coping skills, tools for you? Like what's in your toolkit that are like your top 3 go-to tools for you personally, Dr. Crawford?
And this is a great question because this is usually where people give the answers that they feel like they should be giving, right? But I'm going to give the answers that I actually like use for my tools.
Yes.
And the idea of this is just to normalize, doing what it is that you need to do to fill up your cup, but not feeling like you got to do the thing everyone else is doing, and what everyone else is posting on social media about how to fill your cup, right? And I talk a lot about performative self-care. And nothing against folks who do yoga, meditation, and this, that, and the third. That's fantastic. But if you're not into drinking the green juice, don't feel bad about it, right?
Right.
And so for me, number one, binge watching whatever show I want to binge watch. And the reason for that is it allows me to shut off my brain and to not be sitting with these thoughts that are constantly going through my head. So
What's
for
your show
me,
right now? That's number one, but what's your show really quick? so the audience knows. What's the show?
I knew you were going to ask this.
So it was Love Island, and Love
I was
Island has
gonna say,
now
I hope
finished.
you didn't say Love Island.
I'm as basic as they come. I'm just saying.
Okay, so it was, but now it's what?
Now it's 90 Day Fiance, the UK version.
Oh my God.
Every single 90-day show, spinoff, I've seen them all. I've seen every single one of them.
That helps you.
So yes,
Okay.
so I do binge watching. I also spend a lot of time with my friends, and I make it a priority to hang out with my friends. And I am doing my best, and I've gotten better over the years, of not feeling guilty paying for a babysitter so I can go out to dinner with my girlfriends.
Oh, wow.
Because sitting around, sharing tea, doing the whole kikiing, like, it brings joy to me. It allows me to laugh, and it also allows me to not think about the things I keep thinking about, and also allows me to do some reality checking and reality testing, right? And for my girls to be like, I don't think you really should be worried about that. So it actually is quite helpful for me. And then the third thing that I do, and this is actually really good because I don't know what the third thing is. And I think for a lot of people, we just naturally do things to kind of help manage our anxiety, to help make us feel better, but we're not even realizing that there's like something behind that activity, right? So these are two things that I'm intentional about. Like I say in my head, I'm watching this because I'm stressed. I'm hanging out with my girls because I'm stressed, right? But I guess the third thing that I've been working on and trying to be intentional about is saying no.
Oof.
It's so hard for me to say no. I have a lot of anxiety about it. But when I'm saying no, that allows me to really just protect my mental health, right? It allows me to protect my energy. It allows me to not overextend myself. So number 3 is a work in progress, the whole saying no thing.
That's awesome.
Wow, that's a really good list. I don't think we've had any of those in our responses before.
No.
So I appreciate your transparency in your toolkit. And I think it definitely has to be something that works for you. And I love that you framed it as I need to do what fills my cup, right? And that's kind of first and foremost into creating that kit. So thank you for sharing that. And again, thank you for your time. We hope to have you on again soon. As we always like to remind everybody, if you are struggling, dial 988, the crisis prevention line. If it's an absolute emergency, dial 911. And of course, check out kennedykids.org, where we have a lot of resources for you. And don't forget to check out our events. If you're local in South Florida, we always have stuff going on to support mental health and wellness. And we're looking forward to seeing NAMI out there soon, doing some stuff with them locally. So Dr. Crawford, thank you again.
Thank you, Dr. Crawford. How can our listeners and viewers, reach out to you? How do they connect with you?
Yeah, so on Instagram, I'm Dr. Christine Crawford. I'm also on LinkedIn. And my website is www.drchristinemcrawford.com. So you can find me there as well. For the old school people who aren't on the Instagram and what have you,
Awesome having you. Thank you so much,
Dr. Crawford. Thank you.